Welcome to The Prize Inside. The Prize Inside. A chiropractor's journey in everyday holistic health and vitality. Here, your host, Dr. Jeremy Myers, delves into the remarkable journeys of everyday people who have embraced the path to health and healing. Through his practice, Dr. Jeremy encounters inspiring stories of profound transformation and the power of true healing within each of us. Stay tuned as we discuss various holistic topics and unlock the healing potential that lies within us all.
All right. Sorry, guys. Let me see what I got to do here. Speaker view. Oh. Just a regular. All right. Hang on. Oh, there we go. Yay. All right. I figured it out. Welcome, everybody, to Whole Health Weekly. Hopefully, you're having a great night.
To The Prize Inside.
I always screw something up. Let me make sure everything. Mic check, mic check. All right. Sorry about that. So welcome to Whole Health Weekly, where we talk about the trends of the week. Pretty excited for tonight. There's been some good ones. As always, my office manager, Gina, has come with some TikTok information that was really, really good. So we're going to go into that. So those two topics are respiratory issues that are big on the intranet, and also what else is up there? PCOS, which is called polycystic ovary syndrome. So we can kind of go through that from a holistic perspective. Tonight is always about, looking at things that way. So looking at holistic, looking at different health topics that may or may not, they could be very, very affected by, how you approach them. And so a lot of times when you start looking at things in a holistic way, you get a more control. I would say you just have a lot more confidence when you go in those realms. But I found some other cool stuff that I'm going to add tonight. So I'm pretty pumped about that. Because there is there's a newsletter that I like to subscribe to because it gives me new chiropractic research out there. Completely forgot about it while I was doing this stuff. So what I want to do tonight is do one of the articles out of that as well. So just to let you know that. Our first thing, though, because this is episode number 15 of the Whole Health Weekly. So when the Whole Health Weekly, we do the 33 chiropractic principles. I've always wanted to get it onto a podcast. And so now we're on principle number 15, because that's what we're going by. So without further ado, we're going to start there. Remember, I'm not going to go through all the chiropractic principles. In the comments, wherever you're watching, hopefully, you can. Oh yeah, let me do that too. So if you're into podcast watching, then I want to put that list. Let me get that real quick. This is our last episode. I think this is 1% Tribe. Yeah, that was a really good one. This one is our 1% Tribe podcast. That's on Apple. If you get on there, if you like it, get on there and subscribe. Say how awesome I am at doing this, because that makes it go up. I have 3 on there from like when I first started podcasting, like a few years ago, actually. And then I kind of fell off, and then I really wanted to get it going again. And so I had like 3 or 4, 2 from like different areas that said it was really, really good. So if you can get on that podcast, it pumps up it in the Apple iTunes store. And then I also have in the comments where the Rumble channel is. So all of those are things you can do. And we're on YouTube. I'm not sure yet. I'm a little overwhelmed by YouTube, to be honest with you. So that is a thing that is coming. This is coming, I promise. Okay, so tonight this is the 15th chiropractic principle, and I'll read it first, and then I'll kind of explain it. Because this one, if you haven't been with me on the other principles, then this one is kind of tough because it gets you in the weeds a little bit. So this one, because it's old, remember, we're talking 1890s, right? When this stuff was 1900s, 1890s is when this was written. But this one, the principle number 15 is this: no motion without the effort of force. Matter can have no motion without the application of force by intelligence. Okay. It's very, very easy to understand in that sense. It's basically saying there's no energy, there's no movement, the cells of our body wouldn't do anything, right? Unless there was an intelligence within us. So that with saying that, that kind of proves the point, so principle number 15 is like saying, listen, all these efforts. So if you remember, we'll go through it. Universal intelligence, you can think of nature. So nature has its own intelligence, right? Nature, the universe, whatever you'd like to say, has its own intelligent design. That intelligent design, then we need to interact with. And so we use this matter, this body that we have, and the cells that we have to create what would be in essence this innate. So we have this matter and this intelligence within us to interact with the universal intelligence, uses this matter in a way that is intelligently moved. So a good example is that I use a lot is nature has gravity, the law of gravity. The law of gravity then tells our matter we should build muscle and bones to stand up in that matter. So that's the coolest part of of this innate intelligence that is within us. And really, it's all about understanding that our body is amazing. I'm going to tell you a story out of a patient today, actually. Patient comes in today, and he had a horrible back situation years and years ago, and hadn't really been to a chiropractor in several years, to the point where he was telling me the story. He went to, so his what you hear, like with the, your disc blowing out, those kind of situations. So he went in and he said, the disc blew out, let's say 35 years ago, his legs going numb, all these different things. So at the chiropractor at the time said, listen, you're pretty bad. You probably need some medical intervention on top of like trying to do the chiropractic thing. So he goes in, and the medical doctors at the time were like, dude, if you don't do surgery, or something, you're going to not be able to walk anymore. And the guy kind of did this thing where he's like, you ain't cutting on me, and no way is that happening, right? And so, in well-intentioned, the medical doctors weren't trying to like scare him or anything like that, but he kind of worked with the MDs, worked with a chiropractor, got all that stuff going, and was able to eventually not have surgery on his low back. Now, 30 years going forward, now I see him, and we, check out his lower back. You can see where his injury was because of the arthritis that had built up and over time. And what I was telling him was, isn't the body remarkable? 35 years goes by, you've been able to work, do all these things. And where the injury happened, basically your body did the surgery for you. And he's like, really? I go, yeah, because a lot of times in the old days, one of the first surgeries that there was out there was basically take the disc out in between those two vertebrae and kind of fuse them together, use bone or, something in there to just take the disc out. Once you took the disc out, then you wouldn't be pushing on a nerve or, those kind of things. That's what the surgery was. And it made sense to do that because essentially your body was going to do that anyway. It was going to, and so that's what happens over time is over time, it will, if a disc is injured, then you start getting arthritis in there, right? And so what basically surgery is advancing the arthritic state to get you past the point of this change or that disc in there. And so we were talking about it, how amazing the human body was, that now he has a little low back pain. It's nothing major, but what he went through was pretty traumatic. So back in the day, and the intelligence of the body figured out a way. So I always thought that was cool. But principle number 15, not a huge big deal, but the only way you can create energy that would work for you is to have this intelligence within us that allows that to happen. So just remember that. I thought that was good. All right, let's talk about tonight. We're going to talk about what are some hot topics. So let's start with my office manager Gina's hot topic, which is respiratory issues. Okay, so what I want to do is get into, so respiratory right now is a very big thing. We have sinus issues, which if you're interested in sinus issues, go to Sunday night's 1% Tribe. We did the herbs. They're called anticatarrhal herbs that you can actually learn about. And some of them are really, really good for mucus and making it sure it's created correctly. Let me find... I got my nerd sheet here. I want to get you the good stuff. Okay, so respiratory problems. One of the things, maybe I'm on the wrong path here. Sorry, guys. Yeah. Let me look again. This is boring, right? Okay. Oh, come on. I will find it. All right. I thought that would be in there. Okay. Okay. Well, anyway, so I'll go into that in a little bit. So we'll do, it's because there's a lot of respiratory herbs that could be really, really good. So I don't want to we'll get into that in a little bit. Let me do one other. I got all these tabs going, which I'm not used to, but so bear with me on it. I got to find my good. So when I started getting into these, so here's a couple that we were talking about with some respiratory stuff, right? So elderberry is obviously a very good one for a lot of different things, a lot of different, anything in the lung area. One of my favorite memories of opening up those lung cavities is cranberries. Cranberries can be a huge help. Cranberry juice, especially in kids, if they have asthma or those kind of things. If you can create a cranberry juice with not a lot of sugar in it, that can help a lot of times open up those lungs. There's many different things that can cause you to have some respiratory issues. Okay. So it depends. And right now is a time where you get the sinuses and, those kind of things. And that's where what we talked about on Sunday was anticatarrhals, which are the nasal mucus, those kind of things. So one of that, there's a few different herbs I gave, like eyebright was one, butterbur, goldenrod, thyme, eucalyptus, anything anti-inflammatory. So your ginger, those kind of things, cayenne pepper, right? So a lot of those, the really good ones for your lungs though. So those are all ear, nose, and throat ones. The good ones that are really specific towards your lungs one was called hyssop. It's HYSSOP. Elecampane. That's really nice. That's a really nice tea as well. And Herbacenta. Herbacenta is a really good one. So there's a ton of different herbs when you're talking lungs. It just depends on the respiratory issue that you're talking about. Okay. And then the next topic she had, which is polycystic ovary syndrome. We'll get into that a little bit, but I want to hit some of these hot topics first. before we do that. So what we're gonna do is let's go to the topics of the week. All right. So topics of the week. This week in the current holistic subjects, maternal and newborn health hit the thing. With World Health Day, which was April 7th, 2025. Healthy beginnings, hopeful futures. There's a significant buzz around maternal and newborn health. Conversations are centering around reducing preventable deaths during pregnancy and childbirth, improving access to quality prenatal and postnatal care, and addressing global disparities in healthcare for mothers and infants. This holistic approach emphasizes nutrition, mental health, and empowerment alongside medical care. A lot of times, this is where I love that subject. Really neat day. I think it was yesterday. We had 2 little babies in the office, because mom had just given birth. I mean, literally a couple days apart. That was really, really cool to see. But one of the things that happens, we do a pretty good job when the mom's pregnant, right, of taking care of. We do a lot of, preparation in that time. And especially my new moms. A lot of my new moms they got a lot of information. And so they've really done a good job. I feel like, and check that too. A lot of people that, moms that have come in for chiropractic, they've already done a lot of holistic understanding. And so a lot of times they are a little ahead of the game as far as that goes. But, like as we go, it's super important for that mom after the baby's born to really, really also keep going on those pre-situations, right? Making sure they're eating right, making sure, the breastfeeding's going good, making sure they're eating correctly. Because one of the things mom needs to know is that a baby is not born with any gut bacteria. Okay. So no gut bacteria. I talk constantly about what? The gut microbiome, right? So a baby gets their gut microbiome from 1, the mother, and 2, the father. I think if I remember that last scientist I watched on it, there's like 3 stages of different gut bacteria that happens. So the first one is when the baby is born. When the baby is born, and let's say it's a natural delivery. Okay. So let's say you have a baby that's born of a natural delivery. The baby will then have what they call like the first set of microbiome for the gut, which will be what they call vaginal. So you'll have this vaginal microbiome, which means you have a lot of moms, microbiome kind of in that situation. So if you had like a C-section, your baby might not have, the same microbiome that it needed to if it was a vaginal birth. No big deal. You just, as long as you know it. The next stage is when mom and dad hold the baby, right? And one of my favorite things our doula did for my second daughter is she had the husband take his shirt off and hold the baby with the shirt off, because, no matter what, that skin contact can help. And when you have, so now you're adding, husband's microbiome as the dad and the mom get together. Okay. So they're taking care of this baby. And then second stage, so you go from vaginal when they're just born because they have nothing. And then they move up to, mom and dad's and all those things. That one lasts up till the age of like 2 or 3. And then as they start eating real food, right? So as they start eating regular food out there, they start getting what they call the adult microbiome. And I could be wrong. There might be a stage in there, but they get this adult microbiome going. One of the things they noticed, like in the scientist that I was watching, is he said his one of his scientist kids had an ear infection. He was like 3. And so he had this ear infection, 3 or 4 years old. And so they were going to study. So how you study the microbiome is you do it through poop. So you start with the vaginal, then it came up to the secondary, which was, milk and a lot of mom, a lot of dad, those kind of things as it mixes. And then it starts to get to an adult microbiome. Well, as this kid was pathing up there, that might take several years to get up there. all of a sudden, this kid has an ear infection. So the scientist brings this kid to the doctor. The doctor then gives him antibiotics for the ear infection. They then test his microbiome again, and he ended up going back down to vaginal gut microbiome. We're not sure what this means. It doesn't mean that it's bad or good, right? But it did have an effect. It had a very, very big effect. And that's why antibiotics are, super something you want to be careful with, right? But when he showed that, then it took the kid was 3, typically would have almost adult, gut microbiome, let's say by 4 or 5. Now he's way delayed. And now he wasn't going to get, a good gut microbiome by like 6 or 7. So that was a super interesting, study or a video I was watching on the scientists like that. So just remember that, like when mom's health, it keeps going. It's like even more important after birth to like understand getting those things for mom and baby. Right. And so just constantly working on those things. Once the baby's born, doesn't mean we stop eating correctly. Because once the baby's born, doesn't mean we stop, doing all these cool natural things, right? And so that's something to be aware of as you go forward. So I thought that was good. So, and a lot of parents nowadays are doing chiropractic kind of care throughout. Like we can see little infants all the time checking their spines. There's nothing wrong with them. We're just checking them, right? It means that we're just making sure that little spine is working right like it should. And some babies love it, some babies do not. And so that's always a cool thing too. All right, so that was one topic that was pretty good. Oh, this one's a good one. This is on the second topic to discuss. Integrative health practices. So April being Integrative Health Month has sparked interest in blending modern medicine with traditional therapies like acupuncture, yoga, chiropractic, and herbal remedies. People are discussing how these practices can support overall well-being, particularly in stress management, chronic conditions, reflecting a shift towards a more comprehensive mind, body, spirit approach. My hope in someday that the whole health system will come along with that, and we'll see the need for that more often. It would be really, really cool to see that. But just like in everything, organic food's expensive. It can be, one of those things where, those holistic approaches, because we're not there yet as a society where we're taking care of the whole body. We're still in what I call the sick care model. We go when we're sick, and that's the only time we want to hear from you, right? That's kind of what our model is. Until we get to a true healthcare model where we're actually taking care of ourselves throughout the entire thing, we'll be better off. Okay. Let's see. Oh, this one's a good one. I see this one all the time. So we talked about gut microbiome. So that was top 3. And then this one called contrast therapy. I always just call it hot and cold. All right. So this one's interesting. Cold plunging and all contrast therapy, which is all alternating hot and cold exposure, are hot topics, especially for fitness enthusiasts and those seeking holistic pain relief, like for arthritis. And recent discussions highlight its benefits for recovery, mental health, and immune support, with ongoing research to add to the conversation. Okay. So my thoughts on hot and cold therapies, especially like cold, I love it. I think it's a great idea. One of the biggest triggers, after you kind of hurt or the pain of working out, is the inflammation process. So anything that kind of helps control that inflammation could be good. I've seen some amazing things, especially my athletes after practices should be like dunking in an ice cold bath almost every time. Really can reduce a lot of those like joint stresses. My biggest wish is that we would do it, more my retired farmers. So my retired farmers, that would be fantastic to, get into that situation, where after a long days of work, if you're in the garden or whatever, you get in a cold bath, right? But It's a little harder than you think. Now, the nice thing about cold contrast therapy, which is cold and hot, is that it constantly is causing the cells to circulate. So a lot of times I could see a huge benefit in doing that kind of situation. And so, as you're going, I recommend this highly all the time in back pain, headaches, those kind of things. We see it constantly. It's stuff we recommend. Now, with me, I always say do inflammation first and then heat later, because if you can reduce the inflammation down, then the cells will be able to go a little quicker in that process. Most of the time, people switch it. They put hot on, never do the heat. And so if there's inflammation in there, that's a problem. I'm sorry, they put hot on, never do the cold. That becomes an issue. And so we definitely want to make sure we're doing that kind of thing. Okay. So just remember that. That would be very, very important to remember to, hot cold therapy is amazing for like different aches around you, but just make sure cold first and then heat. That's always my recommendation. Okay. All right. So let's go into. Okay, so now that I have this exciting new topic, I want to go into an article for chiropractic specific, and then we'll go into Dr. Mercola's articles that are really, really good. So let's talk about this. Let's go into this article. All right. This is a study that was on a patient. I love this. Okay, I'm going to read the title and then we're going to go through it. Resolution following chiropractic care of benign paroxysmal positional vertigo in an elderly female. This is a case report and the review of the literature. Okay, this is done by, his name is Andrew Zadowski. He's a chiropractor. Okay. The study object was to see if there was a positive health outcome experienced by a patient who presented with benign paroxysmal positional vertigo, which you guys have heard about, vertigo, right? Positional, which means when you move your head a certain way, it starts it, and generalized cervical pain. Okay, let me read that again. To report positive health outcomes experienced by a patient who presented with. Okay, so he's doing chiropractic, on this lady that she had some trauma to her neck that caused the vertigo. Okay. All right. Presented to the chiropractic center with complaints of vertigo and neck pain after falling out of her bed on a concrete floor. Conclusion. Okay. Well, that's not very long. I wanted to be a little better than that. Okay. Chiropractic care was shown to be beneficial to the patient. Oh, wow. Okay, let me do this. Interventions and outcomes. A thorough exam and history were performed on the patient upon arrival. The patient then received specific chiropractic adjustments utilizing a certain technique. Upon the sixth adjustment visit, the cervical, thoracic, and lumbar regions were adjusted per protocol. On the next visit, the patient revealed that her symptoms of vertigo had dramatically decreased from a 10 out of 10 to a 0 out of 10. So it showed in this study, right? We're not saying it was 1,000 people, but in this study, it was shown to be super beneficial for people with benign paroxysmal positional vertigo and neck pain. More research is needed, obviously, but it shows a promise. And we see that as chiropractors all the time. That think about how the whole vertigo situation hits. So you have an impact. Okay. So let's say she fell out of a bed, fell on the floor. Once you do that, you either have a whiplash or something happens to the joints of the vertebrae of your neck. Once that occurs, then maybe it can realign. If you can remember my talk on vertigo, we had these little, what did I call them? There's these little tubes. Okay. So we have all these different tubes in our ears that have it. Think of a level bubble. So we have like 3 or 4 different levels that keep your body this way, and they're filled with fluid. Sometimes they have to be at certain angles to make sure that the level bubble stays in the middle, right? But what if I take my head and knock it off its axis so your mechanics are wrong in your neck? So if my mechanics are off in my neck, what happens to the level bubble? It's not correct. And so what happens is a lot of times, a ton of people get a lot of benefit from chiropractic adjustments. Now, that might not be the only thing. We've talked in that if you go into my Rumble channel and you find it, there is a one we talk about vertigo where calcium could be an issue as well, like too much calcium sometimes. Some people are taking too much. That allows these little crystals on the top of the little nerves to kind of get into the fluid in that level. Okay. And so once that happens, those little crystals kind of can cause that vertigo to stay, right? But weirdly, chiropractic helps, relieve it a lot because it's balancing out both of those levels. Hopefully that makes sense. So just think of a level that needs to stay level. It's like you put it on the table. It's supposed to be level, right? What if I took that or that table and moved it or shifted it? Then you're going to see a different position for that level. So hopefully that makes sense. I didn't mean to get too crazy, but that was a pretty good one. Let me see if I can find another one. All right. Yeah, shoot. All right. Da-da-da. All right. Well, full article. Sorry, guys. This is like an experiment. I'm going into this new place that. Oh, here we go. Okay. It's just like in a PDF version. All right. I love the word they use for this is called the research magazine's called Coherence, which is awesome. All right. Okay. Oh, this is cool. Okay. So chiropractic, we'll do this one real quick. I won't do the entire article, but this is good. Chiropractic and ear infections. Insights from the largest study ever conducted. How chiropractic care supports natural healing for children with otitis media. Ear infections, also known as otitis media, are one of the most common health issues that young children face. For parents, that cycle of ear infections can be exhausting, leading to frequent visits to doctors and rounds of antibiotics, and even discussions of putting tubes in or invasive surgery. But what if there was another way to support your child's natural healing process? Let me give you an article. Who wrote it? Okay, so this is J.M. Fallon. Okay, so this is J.M. Fallon from the Journal of Clinical Chiropractic Pediatrics. Okay, so just to let you know. Oh, it's Joan Fallon. Okay, this is good. The largest study on ear infections in chiropractic care conducted by Dr. Joan Fallon offers valuable insights into how chiropractic care can help. Chiropractic care does not treat the ear infection. It removes the interference. Okay. It does not try to correct the ear infection. It's just trying to remove the interference so the innate intelligence can do it itself. It's important to clarify that because instead it focuses on removing the obstructions that interfere with the proper functioning of the nervous system, allowing the body to heal itself. In chiropractic terms, these obstructions are often due to shifts of bones, the vertebrae, and the spine. When these shifts occur, they can interfere with the body's nervous system, affecting everything, including the immune response. And so, in the largest study on ear infections, this was done this was 1997. This is the biggest study ever done. It involved 332 children between the ages of 27 days and 5 years who had previously been diagnosed with an ear infection or otitis media. These children were referred to Dr. Fallon to be adjusted. The objective was to evaluate the infections. Nope. Where are we at? The efficacy of chiropractic adjustments in the resolution of ear infections using it's called tympanography, a reliable objective tool used to assess ear health. Sorry, I'm like stumbling all over the place. The study's findings were very impressive. The children in the study received chiropractic adjustments tailored to addressing the specific spinal misalignment that was believed to impact ear health. The results demonstrated that many of these young patients experienced significant improvement after receiving it. For children with ear infection, with acute ear infections, the average number of adjustments needed to resolve the condition was about 4. And it took average about 6 days to normalize their ear examinations. For those with chronic or more serious ones, it took about 5 adjustments needed, and it took about 8.5 days to normalize the conditions. Children with a mixed type of bilateral, both of them, required a little bit more, so like 5.5 adjustments-ish in about 9 days. Even children who had no active otitis media at the time of examination, but a history of multiple bouts, benefited about 5 visits. It also tracked the recurrence rate, which is a big deal. The recurrent rate so that happens a lot with ear infections. It happens more and more often. So the recurrence rate for acute otitis were 11.2, while chronic was 16.4, when mixed was a higher rate of 30. But it played a critical role because a lot of those numbers were up in the like 60 to 80% of the time you'd have the reoccurrence. So it's a big article. I don't want to beat you guys up on it, but next time I come, I will do the whole article. But the idea is that there is in 1997, she did this study with a lot of kids, and it showed that it has a very nice effect. In fact, it's so much better than the struggle, but a lot of people don't know about that. Ear infections and chiropractic can be a huge thing. Okay. So hopefully you like that. Give me a thumbs up if you did. Hopefully we will get this kind of rolling in the right direction. Ooh, let's see. Now we're going off to Dr. Mercola's situation. All right, let's do this one. Okay, so this one's going to be important because there's a lot of people that suffer or know somebody that suffers with type 2 diabetes. This one could be a good article to kind of walk through to see, because type 2 diabetics actually have a lot of vitamin deficiencies. So we're going to go through those. So if you know somebody that's close to those vitamin deficiencies, this will be a good one. A study analyzed 52,501 type 2 diabetic patients. They found widespread nutritional deficiencies. The most common being vitamin D. Vitamin D was the most common, followed by magnesium, and then vitamin B12. Vitamin D deficiency significantly impairs insulin function and sensitivity while increasing the risk of complications like diabetic retinopathy, kidney disease, and foot ulcers. Magnesium deficiency creates a vicious cycle among diabetics. Low intake increases diabetes risk, while diabetes increases magnesium loss through urination, leading to poor glycemic control. Metformin, most prescribed diabetes medication, depletes vitamin B12 levels by interfering with B12 absorption, which can lead to nerve damage, numbness, and fatigue. So you just got to watch that stuff. All right. So remember that. So if you know somebody that's type 2 diabetes or yourself, remember vitamin D supplementation, super critical. Magnesium supplementation, critical. Remember, in magnesium, we want to take just enough. You don't need to take a ton of magnesium, obviously. And then B12, because a lot of it doesn't get absorbed if you got to have certain medications out there. Okay, so that was a pretty good one. All right, let's look at. All right. Ooh. Okay, so let's do this one. This one's by Dr. Mercola as well. Limiting TV time helps reduce heart disease risk. That's interesting. Spending more than 2 hours a day watching TV increases your heart disease risk by 12%, even if you had a low genetic risk for type 2 diabetes. Interesting. Limiting television viewing to less than 1 hour daily cuts heart risk even in people with high genetic risk for type 2 diabetes, according to new research. Extra hour of daily TV time raises your chances of developing heart disease by 3%, building up dangerous plaques in your arteries over time. Huh. Why? Why would that be? Watching TV displaces physical activity, encourages junk food and alcohol consumption, and leads to sluggish blood flow and dangerous blood clot formation. Reducing your TV time and moving more helps prevent heart disease, no matter your genetics. Sitting is a simple, powerful daily change. Okay. So as we look at this, what we're talking about is watching TV isn't the problem. It's sitting. And what happens in our patterns when we start watching TV? What do? We eat. Okay. So now one of the things that I learned is you have two different nervous systems, right? You have a sympathetic, which is what they call the fight and flight. And then you have the parasympathetic, which is what they call rest and digest. Well, one of the things I learned was, let's say you're watching an exciting, let's say shoot 'em up movie that's real tension. As you're eating, your body is actually in a sympathetic mode. And the sympathetic mode is coming through your body, and it doesn't want to eat things. It doesn't want to eat things because you're in this fight or flight mode. So it's really important to remember, try not to eat while you're watching TV is a big one. And a lot of times we get stuck watching something and you'll sit for a longer period of time than you should. It's very, very easy. All of us know you sit at a computer, next thing you know, it's 3 hours later, right? It's just the way it goes, and it's okay, right? This is just a good way to, get in there and see what's happening, right? That's pretty cool. So that is really good. Now I'm going to go look up. I want to do. All right. Okay. So let's do. I'm going to do an article on what Gina said is one of the topics this week. The Dr. Mercola. This is a article by September of last year. Polycystic ovary syndrome. It's a health issue affecting women worldwide. Polycystic ovary syndrome, or PCOS, affects almost 5 to 6 million women in the U.S. and 8% to 13% of women worldwide. It is characterized by elevated testosterone, ovulation problems, and large ovaries with small follicles, impacting fertility and mental health. Women with PCOS are at a higher risk for depression, anxiety, eating disorders, and suicide attempts. PCOS also affects self-esteem, gender identity, relationships, and sexuality. Polycystic ovary syndrome has no specific cause or cure. Interesting. But risk factors include family history, diabetes, and insulin resistance. Symptoms are manageable, and pregnancy still occurs with proper treatment. Okay, so this is some nutritional, and then we'll give some advice that I've found personally. Inositol, which is it's a vitamin. Oh, why do I always forget? Inositol is what? But what? Okay, what vitamin? B8. Okay. It's hard to remember that one. So inositol is vitamin B8. Okay. So it's one of those that you want to get in there with a good multivitamin or a B complex. You're going to get some B8. So that's good. And then carnitine is the other one. Where did I go? Oh, inositol and carnitine are supplements that show promise in managing PCOS symptoms, improving menstrual regularity, fertility, and other metabolic markers. Other helpful supplements include CoQ10, turmeric, which is a great herb for inflammation, licorice, and vitamin K2. So hopefully that'll help people. The other one that they think is really linked to PCOS, that is something that is a major issue, is environmental factors. And I think this has a lot to do with it. Environmental factors like exposure to PFAS. Okay. So the little plastic, the microplastics that they're finding in like a ton of our foods and water supply. It's terrible, but it's been there a long time. That's why it's important to make sure you have the right, proper filtration on things, eating as clean as you can, because these are little microplastics they find in anything from clothes to food to our water supply. That's what PFAS are. And now they're actually testing for them, which is good. They increase your risk of polycystic ovary syndrome and disrupt the hormones. Okay, so just remember that. And they recommended this article progesterone therapy, which could be a good thing to help balance the hormones, or like an endocrine doc, obviously. But I want to add my 2 cents. If you look at the the supplements that they were doing, you're talking B8, which is, in a normal B complex. You're looking at carnitine, right? And then trying to stay away from environmental factors. Many times it could be a very helpful thing to get your gut health correct, right? And get your chiropractic, your spine aligned in a proper way that allows the nervous system to communicate to the rest of your body and allow the immune system to work properly. I've seen some really cool things, like people that have really taken a journey. And most of the time when I see PCOS stuff, it's a very tough, hard situation on fixing your diet. Okay. So eating very, very clean, starting to live that the way you want to. But one of the big things is the hormone imbalance. So they say testosterone, I have a hard time with an overabundance of that. It could be. It's obviously showing up medically. So sometimes it's just the imbalance that's there, right? And so a lot of times I'll question that a little bit, that is the cause, because they really don't know. So they're kind of grasping at straws there. I think most of the time it's going to be some kind of hormone imbalance. And so there is a ton of ways to really focus on that in the natural world, getting, like for instance, in our office, good blood work, getting adjusted on a regular basis, start eating right, seeing what you need for supplementation, making sure that your gut is doing well so that all those supplements could be a really, really good thing. So with that, friends, that was fun. I think that's the one I'll leave on. But I'm excited to have found this thing tonight. Oh, where'd it go? Where we can access chiropractic stuff. Oh man, there's a whole article next time. Oh man, it's chiropractic, vertebral subluxation, and immune function. So what we'll do is go through all the articles of research that's there as well. So, but any questions for me, remember, you can do comments anytime in the chat, anywhere, but make sure that you do that and subscribe to the Rumble channel, do the podcast, whatever you'd like to do. Hopefully you guys enjoy this. Some nights I get good. It's always tough. It was like hit and miss. And I think I forgot to tell everybody what time, we were going today. So I appreciate you guys. And hopefully that was helpful. And I will see you next week. Have a good one.